The House may wish to know that when the country recorded the first COVID-19 pandemic cases, the Ministry of Health engaged cooperating partners, both bilateral and multilateral, for support to complement government's response efforts in fighting the pandemic. In response to our request, a number of cooperating partners pledged support. The money pledged was to be utilized by respective implementation units and was earmarked to be channeled through institutions such as the World Health Organization, WHO, the United Nations Children's Emergency Fund, UNICEF, and non-governmental organizations. In this regard, the cooperating partners did not envisage to disburse this support through the ministry, but to undertake consultations with the government on materials that were required to be purchased and supplied to government. Further, the cooperating partners indicated that their support was not going to be provided as direct finances to government, but as in-kind, in form of support materials. For instance, the Federal Republic of Germany pledged to disburse its support through World Health Organization and UNICEF. Through these agencies, Germany purchased and supplied personal protective equipment, PPEs, testing kits, water treatment chemicals, and many other forms of materials that are being used in the fight against COVID-19 pandemic. On the material date of the report, the 31st July 2020, the stated amounts remained pledges, as no amounts or finances or materials had been disbursed to government by any of the cooperating partners. Finally, I wish to inform the House that as of 30th December 2020, out of the 6,399,226 Kwacha pledged by cooperating partners had informed Ministry of Finance that 1.9 billion Kwacha worth of materials had been disbursed. The disbursed materials were in form of machinery, equipment, water treatment chemicals, and other forms of materials that have been dispersed mainly through World Health Organization, UNICEF, and NGOs as highlighted above. Mr. Speaker, with that clarification, it is not correct to allege that Ministry of Health misappropriated 6.3 billion Kwacha COVID-19 funds. And Mr. Speaker, the House may wish to note that the interim report on the audit of the Auditor General on the utilization of COVID-19 resources is before your committee. And by established parliamentary practice and procedure, the details of the observations and recommendations of the committee will be known after the report has been tabled and adopted by the House, because the House has to do its oversight function. In addition, the House may also wish to note that the Auditor General has been requested by the Public Accounts Committee to undertake a forensic audit on the utilization of COVID-19 resources at the Ministry of Health. And I want to assure this House, and through this House the nation, that His Excellency President Edgar Chagwa Lungu has demanded for total transparency and accountability in this forensic audit.